One of the most confusing parts about healthcare isn't just where to go, it's who you're supposed to see. You wake up with a new symptom and think, do I call my doctor? Do I need a specialist? Or what about that hospital doctor that helped me last time? If you ever ask those questions, you're not alone. Most people get bounced around between offices without really knowing who's who, and that confusion leads to wasted time, frustration, and surprise bills. In this module, we'll break it all down. You'll learn who does what, when to see each person, and how all these professionals fit together on your care team so you can make the system work for you and not against you. Alright, for the agenda for this module, we have primary care, your point of contact, specialists, the focused experts, hospitalists, the doctors you meet in the hospital, other important roles in healthcare, how these roles work together, pro tips for patients, closing, and next step. Do you have a main doctor or a clinic you think of as your home base, or do you just go wherever has the soonest appointment? If someone asks, who is coordinating your overall care, would you know exactly who that is? Primary care, your main point of contact. Your primary care provider, sometimes called your family doctor or regular doctor, is your home base. They handle checkups, manage prescriptions, treat colds and flu, track your overall health, and keep an eye on long-term conditions like blood pressure or cholesterol. They're also the quarterback of your healthcare team, coordinating all your care and keeping everyone else in sync. From an insurance perspective, your primary care provider is often the gatekeeper. They help you get referrals, order tests, and make sure the next step is covered. Skipping them can mean bigger bills later. Types of primary care providers and what they mean. Family doctor, trained to care for everyone, babies, adults, and grandparents alike. Think of them as the one-stop shop for the entire family. Next, we have internal medicine doctor, focuses on adults. They manage complex conditions like diabetes, heart disease, and pain management. Next, we have the pediatrician, the children's doctor, expert in growth development and childhood illnesses. We have the geriatrician, specialized in older adults, helps balance medications, prevents falls, and support aging safely. And next, we have nurse practitioner or physician assistant, medical professionals who diagnose, prescribe, and manage care. In many offices, you'll see them most often because they're easier to schedule with. Now, here's an example. Let's say Kevin gets a weird rash on his arm. He visits his family doctor. They rule out infection and prescribe a cream and say, if this doesn't clear in 2 weeks, I'll refer you to a skin specialist. That's coordinating care that flows step by step. Now, did you know people who stay connected to primary care providers are statistically healthier and spend less on medical care each year? It's not just about checkups, it's about having someone who knows your story. Have you ever wondered, do I really need a specialist or could my regular doctor handle this? When you hear the word specialist, do you also think expensive? And do you know how referrals can change what you pay? Specialists, the focused experts. When something specific needs deeper expertise, your doctor sends you to a specialist, someone trained to focus on that one part of the body or one type of disease. You can think of your primary care as a general contractor and specialists as electricians, plumbers, or carpenters of the body. Now, here are some common specialists explained. Cardiologist, the heart doctor, checks chest pain, heart rhythms, or blood pressure that's out of control. The dermatologist, skin doctor, handles acne, moles, rashes, and skin cancer checks. The orthopedic doctor, bone and joint doctor, helps with broken bones, knee pain, or sports injuries. The neurologist, the brain and nerve doctor, treats headaches, dizziness, seizures, or memory problems. The gastrologist, the stomach doctor, handles acid reflux, ulcers, or digestive issues. The endocrinologist, hormone doctor, focus on conditions like diabetes or thyroid problems. OB/GYN, women's health doctor, manages pregnancies, hormones, and reproductive care. The psychiatrist, mental health doctor, treats depression, anxiety, and other mental illnesses and can prescribe medications. Specialists are more expensive. Most HMOs and POS plans require a referral from your main doctor first. PPO plans often don't, but you'll still save money if your primary care provider connects the dots first. Now, here's an example. Maria goes straight to her orthopedic specialist for knee pain without a referral. The visit costs her $350 out of pocket. Her coworker Jasmine calls her family doctor first, gets a referral, and pays just a copay of $30. Same treatment, a $320 difference. Whenever you think you need a specialist, pause and ask, have I talked to my main doctor first? That one call can save you time and money. Have you ever stayed in the hospital? Did you know who was actually in charge of your care while you were there? After leaving the hospital, did it feel clear who was supposed to follow up with you, or did you feel a little lost? Hospitalists, the doctor you meet in the hospital. If you ever stay overnight in a hospital, you'll likely meet a hospitalist, a doctor who works inside hospitals. They don't see patients in a regular clinic. And instead, they take over your care once you're admitted. Their job is to oversee your day to day treatment, coordinate with your surgeons, specialists, or nurses, adjust medications, and order tests, plan your discharge safely. Because hospitals run around the clock, hospitalists work in shifts. You might meet two or three during your stay, but they all share notes so your care stay consistent. After you leave, your primary care provider takes back control. That's why following up within 1 to 2 weeks of discharge is so important. It keeps everyone on the same page. Now, here's an example. When Tony was in the hospital for pneumonia, the hospitalist checked his progress every morning and adjusted his antibiotics. After discharge, his regular doctor followed up, reviewed his x rays, and helped him stay on track with recovery. That's teamwork in action. Did you know hospitals have helped reduce hospital stays by improving communication between departments, saving both patients and hospitals money? When you think about your care team, do you only picture doctors or do you include nurses, pharmacists, and front desk staff too? Of all the people you interact with in healthcare, who do you talk to the most? And how could they help you more than you're already using them now? Other important roles in healthcare. Beyond doctors, there's a whole network of professionals keeping things running. Here's who they are and what they do in plain English. Now, we briefly went over nurses and physician assistants, but again, these are highly trained professionals who work alongside doctors. They can diagnose, treat, and prescribe medication and often have more time to talk to patients. In many states, nurse practitioners can work independently, especially in smaller towns and clinics where doctors are in short supply. Next, we have case managers and care coordinators. These are nurses or administrators who help when your care gets complicated. They call back to check on you after surgery, set up follow ups, and help schedule referrals so you don't fall through the cracks. Next, we have pharmacists. Pharmacists do far more than hand you pills. They check for drug interactions, make sure dosages are safe, and often help you save money by suggesting generic options. Many pharmacists now even give basic vaccines like flu or COVID shots. Next, we have physical, occupational, and speech therapists. Therapists help people regain movement, strength, and independence after injury, stroke, or surgeries. Physical therapists focus on movement and pain recovery. Occupational therapists help you relearn daily tasks like dressing or cooking after illnesses or injury. Speech therapists help with swallowing or communication issues. Next, we have radiologists and lab technicians. These are the behind the scene experts who read your x rays, MRIs, and lab tests. You may never meet them, but they're critical. Their reports help guide your treatment decisions. We have front desk and billing staff. They're the real MVPs of the clinic. They verify your insurance, handle scheduling, and translate confusing billing codes. If you ever see something wrong on your bill, they're the best place to start. Insurance representatives, they're not medical providers, but they're part of the healthcare team in a different way. They determine what's covered, process claims, and explain your benefits if you know who to call. Now, here's an example. After surgery, Aisha worked with a physical therapist twice a week, a case manager who coordinated her appointments, and a pharmacist who helped with her switch to a cheaper medication. Different people, one goal, keeping her healthy and saving her money. Behind every doctor you meet, there's dozens of professionals supporting your care, even if you never see them face to face. Think about your last big health issue. Did it feel coordinated, or did you have to chase results and answers yourself? If something fell through the cracks, do you now know which roles you might contact first to fix it? How these roles work together. Here's what it looks like when everything connects smoothly. You start with your primary care doctor for an exam. They notice something off and refer you to a specialist. You get tests ordered by a lab technician or radiologist. Your results go back to your primary doctor who explains them. A pharmacist fills your medication and double checks safety. If you're hospitalized, a hospitalist will manage you inside. After discharge, a care coordinator team helps you schedule follow ups. That's how it's supposed to work, a chain of communication centered around you. When you break it down, like if test results never get forward or your insurance not covered, that's when frustration starts. But knowing who's who means you know who to call to fix it. Right now, do you feel like you're in charge of your care or more like you're just reacting to whatever the system does? Which of these roles, primary care, specialist, pharmacist, care manager, could you lean on more to make your life easier? Pro tips for patients. Here are a few ways to make the system work better for you. 1. Always confirm referrals before seeing a specialist. Even if your plan doesn't require one, it keeps your care coordinated and prevent billing surprises. 2. After hospital stays, follow up within 1 to 2 weeks. Your regular doctor can catch medication issues or symptoms before they become emergencies again. 3. Use your pharmacist. Ask them if there's a cheaper version of your medication or if any of your drugs might interact. 4. Keep a short medical summary on your phone. Your list of medications, allergies, surgeries, and main conditions. It saves time in every appointment. And lastly, do not be afraid to ask who's managing your care. If you're unsure who to contact about results or next steps, ask who's my point person for this. You deserve clear answers. After this module, if someone asks, who's your main healthcare person? Do you now know who exactly it is? What's one thing you'll do differently next time? Ask about referrals, schedule a follow up, or use your pharmacist more? So now you know who's who. Your primary care provider is your home base, your specialist or your focus expert, your hospitalist step in when you're admitted, and your support team, from nurses to pharmacists to billing staff, keeps everything moving behind the scenes. When you understand how each role fits, you'll save time, avoid frustration, and take back control of your healthcare experience. In the next module, we'll cover one of the biggest everyday questions. When should I go to the ER, urgent care, or just call my doctor? Now that you know the people, we'll connect them to the right places so you always know where to go next. See you in the next module. Thanks for watching.